Bismillahirrahmanirrahim. I am Dr. Mohib Wazir, and the topic is the musculocutaneous nerve. To understand the musculocutaneous nerve, please look at the anatomy. Look, this is the clavicle and this is the coracobrachialis. This is the coracoid process, and originating from the coracoid process, you can see this is coracobrachialis and this is short head of the biceps. Just medial to the coracobrachialis lies the lateral cord of the brachial plexus. The musculocutaneous nerve, it originates from the lateral cord of the brachial plexus with the root value of C5, 6 and 7. And now note that the musculocutaneous originating from the lateral cord, it immediately passes laterally toward the coracobrachialis and it gives branch to supply the coracobrachialis. And then it pierces through the coracobrachialis and then comes to lie between this biceps muscle and the brachialis muscle. And over here it gives branches to both of the muscles, that is to the biceps and brachialis. In this way, the musculocutaneous nerve supplies the C, B, B, coracobrachialis, biceps and brachialis, or from the other side BBC, that is the biceps, the brachialis and coracobrachialis. And after supplying motor supply, then it comes out from over here. You can see from the lateral border of the biceps, and now it pierces the D fascia and descend down along the lateral border of the forearm as the lateral cutaneous nerve of the forearm, giving branches to the anterior side as well as to the posterior side. In this way, the lateral border of the forearm, both on the anterior and on the posterior, the lateral strip is supplied by musculocutaneous nerve. In this way, musculocutaneous supplies the skin along the lateral border of the forearm and the three muscles BBC, biceps and brachialis and coracobrachialis. Now these muscles, the biceps, brachialis and coracobrachialis, are flexor of the shoulder and flexor of the elbow and supinator of the forearm. That's why if the musculocutaneous nerve is injured, usually the musculocutaneous nerve is well protected in the muscles. It can only be injured if there is stabbing to the muscles, or during surgery, if from the medial side the surgeon goes toward the shoulder joint, then from there to pectoral approach, it can injure the musculocutaneous nerve. Now note the point. If the musculocutaneous nerve is injured inside the coracobrachialis, then the coracobrachialis will be saved because the branch of the coracobrachialis is given by musculocutaneous before it enters into it. But if it is injured before it reaches to the coracobrachialis, then the coracobrachialis, biceps and brachialis, all the three will be paralyzed. In this way, flexion at the shoulder and flexion at the elbow will be affected but not completely lost, because flexion at the shoulder is also being performed by the pectoralis major, and flexion over here is also performed by brachioradialis muscle. Supination of the forearm will also be affected because of the biceps, but it will not be completely lost because supinator is also done by supinator and brachioradialis in addition to the bicep. That was, it will be big supination but still will be there. Thank you very much.